Welcome to our lecture tonight, The Changing Landscape of Desexing, presented by Dr. Stuart Mason. This webinar is proudly brought to you by Virbac Animal Health. Dr. Mason graduated from the University of Melbourne in Australia in 1999. After 2 years of mixed practice work in West Gippsland in Victoria, Stuart moved to small animal practice at Monash Veterinary Clinic in the southeastern suburbs of Melbourne. He became partner here in 2005. I think it was 2012, Stuart became a member of the Australian and New Zealand College of Veterinary Scientists in animal reproduction, and in the same year, a diplomat at the American College of Theriogenologists. Try saying that 3 times. Stuart has been performing small animal reproduction work since 2002, including inseminations with fresh, chilled and frozen semen in bitches. And Stuart has extensive experience in transcervical insemination, or TCI, and has published 2 papers on the use of TCI with frozen semen in the bitch. One comparing pregnancy results of TCI to surgical insemination, the other presenting continued results on frozen TCI. Stuart has special interests in assisted reproductive techniques, pyometra, which just sends chills up my spine, even the word, and the effects of nutrition on reproduction. This looks to be a really topical presentation. I know I'm seeing a lot of 8-week-old puppies and kittens around at the moment presenting at the clinic already desexed, so it'd be really good to learn what you have to say about the situation. So I will be very attentive. Welcome, Dr. Mason.
Thank you, Chantal. I will apologise too. I've asked my children to be quiet, but after 3.5 months in lockdown here in Melbourne, it's getting a bit challenging at home. So hopefully they're good, but 10, 12 and 14-year-old, you never know what's going to happen. So, but thank you to Vet Education and Virbac for asking me to speak tonight. We're going to talk about the changing landscape of desexing, vasectomy, ovarian sparing spay, non-surgical, or do we just not bother desexing them at all? So I guess we've got to look at what has changed over the years with desexing in Australia. And I guess castration's always been just castration. Vasectomies have come about and more common, I suppose, in more recent times. But when we look at spays, there's some differences that have happened over the years. Traditionally, spays were always a full ovariohysterectomy. For a while, there was some people advocating cutting a piece of the ovary off after removal and burying it in the liver so that it secreted a little bit of estrogen to try and help stop side effects. Mainly incontinence. So that's obviously gone out of favour over the years. There were times people would recommend spaying after the first heat. When I graduated 20 years ago, it was always 6 months was the one rule that suited everything. So when everything was 6 months old, we recommended to desex. So, and I think that came about probably after the era of non-gaseous anaesthetics, because they wanted the animals to be a certain sort of body weight and size to hopefully survive the procedure. So I guess at university, that's what we're all taught. And then over the years with my further studies in reproduction, obviously we've gained more information and insight into what, is there just this one rule that suits everything? Around the year 2000, when I graduated, I remember the AVA and the RSPCA did a roadshow. I know they did it through Victoria. I'm not sure if they did it right around Australia, they probably did, where there was a big push for juvenile desexing. And, it was pushed that, everything should be desexed by the time it's 12 weeks old. It is easier, I must say. There's less fluid, there's less fat. Obviously, the puppies or kittens are desexed before they go to their new owners, so there's less worry, less morbidity than doing a fat 2-year-old Labrador bitch. And at the time, I remember that we were told that, the side effects of desexing were not proven. And, there was really no difference to desexing at this young age to desexing at an older age. And so I think it was around that time there was sort of this push to start desexing animals younger and younger. And then we look at, more recent times in the last sort of, I would say 5 to 6 years, there's been more talk about ovary sparing spays, tubal ligation, vasectomies have become a bit trendy, which are obviously different to what we were taught at university. And this has come about, as we'll go through, from, I suppose, different knowledge and questions we have about the effects of desexing an animal. An interesting thing is, the whole way through this timeline, in Europe, it's always been preferred to do an ovarectomy rather than ovariohysterectomy, unless you had some sort of evidence of uterine disease. So obviously, desexing at a pyometra, or if you had a uterine tumour or severe cystic endometrial hyperplasia, that would change that. But just something different to what we're taught here in Australia. And really, when we look at what we are taught at university, we only do a partial ovariohysterectomy. We're sort of told to ligate down as close to the cervix as we can get and remove all the uterus. But in general, this doesn't happen. There's a push for smaller incisions. And obviously, it's hard to get a tiny incision that you get good ovarian exposure and good cervical exposure. And technically, if you do a proper ovariohysterectomy, you should actually remove the cervix as well. So what is desexing? Obviously, it's removal of the gonads. We get loss of our reproductive hormones, obviously loss of gametes, so we can't reproduce. And in females, we can, in general, do an ovariectomy. This is the traditional stuff, or ovariohysterectomy. In the males, obviously, complete removal of the testicles. So it's important to remember, these procedures are just so routine, I suppose, that they're done in every practice every day, and everyone gets a bit complacent. But we've got to remember these tissues are full of germ cells. So, we do have to be careful when you're doing these procedures. And I wasn't planning on running through how to do a dog spay, I'm sure, and castration. I'm sure everyone knows how to do it, but we need to avoid incisions that go into the ovaries or the testicles. So I've certainly seen a dog that's presented with a Sertoli cell tumour in the skin, which is where the incision site was for the dog when it was castrated. So, I think the dog was about 8 or 9 years of age and it was castrated at 6 months. So, we've got to be careful about cutting right into these organs and releasing these germ cells that could come back later to cause a problem. And the same would happen with ovaries. If you can't ligate deep under the ovary on the ovarian pedicle and you end up cutting through part of the ovary, then you're going to have a higher probability of one, ovarian remnant tissue, or ovarian remnant tissue coming back in a number of years, because there's still blood supply to the area and it only takes one cell to sort of get moving. So what's the purpose of desexing? So obviously the main purpose that we do it for is contraception. And we're told it's the best thing for control of animal populations. And obviously we want to prevent genital tract disease. So we want to prevent pyometra, prostate disease in males, gonad tumours, reproductive tract tumours as well. Obviously it's also advocated for behavioural changes, and urine marking or aggression. I'll talk more about the aggression later, but they're probably the main reasons why, as vets, we would recommend to do this procedure, and also, council regulators would recommend and push everything to be desexed. So if we look at desexing rates in Australia, I would say very high. Australia and I believe America have the highest percentage of desexed animals of any countries in the world, and it's increased. Over the years, it's gone up and up, because and part of that's there's more animals that are desexed as puppies and kittens before they're sold. Obviously, welfare groups, everything's desexed before it's rehomed as well. So the majority of pets we would see in Australia would be desexed, and we compare that to overseas and Europe especially. It's not as common. In some countries, I believe Norway, it's still illegal to routinely desex pets. So they've got to have they look at it ethically, that the animal needs to have a medical reason for desexing it. And so until they've got mammary tumours, pyometra, prostate disease, testicular tumours, then you have a reason to desex them, but they sort of see it as unethical until that point. Sweden, it used to be illegal. I believe it is legal now to desex at any point, but it's sort of still not felt to be a sort of a normal behaviour. And so it's interesting because you look at a lot of these countries and they have a lower rate of stray animals compared to what we have in Australia and in America, and we're always sort of push you need to desex everything to stop stray animals. But it sort of makes you question, is it just the fact that they're desexed, or is it partly a bit of a cultural thing and an education thing? You know, I think if our kids grew up around entire animals more, they would behave differently with those animals and be sort of, I suppose, more careful where they go, how they're controlled, so that they're not mating uncontrollably around the streets. So then we have a look at what is the normal hormonal process that's important to understand for all this discussion in males and females. So obviously, if we look at the female, obviously the ovaries, they have oocytes in them which are contained within follicles, and the development and the function of those follicles is under the control of LH and FSH, which is secreted under the influence of GnRH from the hypothalamus. There's obviously feedback as estrogen is produced by follicles, which have negative feedback back against GnRH levels. And a similar thing with the males, obviously sperm formation and testosterone production is under the influence of FSH and LH, which again is from GnRH, and our testosterone and dihydrotestosterone provide negative feedback to control the secretion of FSH and LH and sperm development and testosterone production in our boys as well. And so what happens when we desex them? So obviously you get a lack of you remove that source of negative feedback. So when we castrate a male, obviously the boy's testosterone level will drop straight to zero. There's no negative feedback onto the hypothalamus, so GnRH levels will go up through the roof, and luteinizing hormone and FSH levels will increase dramatically. It can take some time for that to happen, up to sort of 42 weeks, and it's often a way of because we have this high level of LH and there's an LH assay, it's a simple way to do a test to see if an animal has actually been desexed in the case of females, or if you're worried about retained testicles in males, it's fairly reliable, or it is reliable, I should say, to measure our LH levels, because an entire animal, unless you happen to hit the LH surge of a bitch ovulating or about to ovulate, LH levels are going to be low, and they're going to be low in males, entire males as well. So it's important to understand that. And there was some belief for a while that after time, LH levels started to wane and dropped back down to zero, but it doesn't happen. The pituitary just continues to secrete LH forever and for the lifetime of the animal after they've been desexed. So when we look at when we've got our client there and we are discussing with them what to do about desexing, and as I alluded to earlier, I think when I graduated we were just sort of told 6 months, so it become a one-liner in that first puppy vaccination, let's book him in now for our desexing at 6 months. But really we should be discussing with people, I suppose, what the potential side effects are with desexing, so that people are aware with what's happened. And obviously with my specialty, I get more people coming to me which want, I suppose, more in-depth advice than the average client, but I think it's important to talk about these things with people so that they're aware of what's going to happen to their animal, or could happen to their animal, I should say, after they've been desexed. So we'll have a chat about skeletal effects related to desexing, incontinence, obesity, coat changes, cancer, temperament, conformational, genital tract diseases, and it's important to understand all of this so that then we can talk about later the different and new options, I suppose, that are out there, and what we could be doing and should be doing to advise our clients. So if we look at skeletal effects, estrogen and testosterone are important for closure of growth plates. So these guys did a study to actually assess how removal of estrogen and testosterone before growth plate closure actually affects the closure of the growth plates ultimately, which, you know, and then is it going to have effects on the growth and development of the puppies? So they took x-rays of the forearm from 8 weeks of age and then monthly. And what they found was if an animal was desexed at 7 weeks, the growth plate stayed open for an additional 17 weeks compared to their entire counterparts. So they had some in the litter they desexed at this age and some that they left entire. And they found that if they desexed them at 7 months, then the growth plate stayed open for an additional 12 weeks compared to their entire counterparts. So, you know, in a normal animal, growth plates close at about 10 months, 9 to 10 months after puberty. But in these situations where animals are desexed young, and even 7 months where we're all told that's the best time to do it, the growth plates are open for an additional 3 to 4 months. So what does this do? Obviously, these animals have a higher risk of growth plate fractures for a longer period of time, but also it's going to affect the growth and conformation of the animal. And so you'll end up with the puppy that's desexed at a juvenile desexing will end up having much longer bones than their entire counterparts, which obviously is going to affect the overall structure of the animal and can contribute to other diseases and orthopedic problems with the animals. So that's our first thing that we need to talk about when we're going to desex. And so cruciate ligament rupture. So that's another one. It's been found that desexed animals have a higher incidence of cruciate ligament rupture compared to entire animals. So, you know, obviously no one 100% knows why animals get cruciate ligament disease. You know, it's not usually trauma, but in some cases, obviously it can be. I know some people talk about it actually being a disease of the ligament itself, but obviously with these changes, as I was saying, with growth plate closure and length of bone, then you're going to get changes in the angulation of the stifle joint. And so, you know, if that growth plate stays open for too long, there's more chance of injury to it. And so that's obviously going to increase the chances of a change in angle in the stifle, which is going to make the animals more predisposed to actually rupturing their cruciate ligament. So there's also some question, as I'll talk about later, whether the luteinizing hormone has a direct effect on the cruciate ligament as well, because we have found luteinizing hormone active receptors within the cruciate ligament itself as well. But one thing is and this has come about because this study here has found that that the incidence of cruciate ligament injury actually doesn't really matter always how old the dog was when it was actually desexed. So hip dysplasia is different people have different views, I suppose, and it depends what papers you want to read, but the general consensus is that there's certainly an increased risk of hip dysplasia in castrated male dogs compared to entire male dogs. This study found no difference between female dogs and unless they were desexed before 5 months of age. That was increasing the risk of hip dysplasia, and it's most probably related to that delayed growth plate closure and incomplete coverage of the femoral head, and so you're going to get potentially more laxity in that joint, which is going to lead to more arthritis, which is really what we're looking for when we're diagnosing hip dysplasia. But also what they've found is to whether the desexing actually makes a difference or not, it needs to be in breeds that are predisposed to hip dysplasia anyhow. So it's not found to make a difference in your small breeds of dogs that don't traditionally get clinical hip dysplasia. So incontinence in females is probably one of our, I suppose, most common side effects that we would see after desexing. And it does occur in males as well, but it's obviously not as common as females. And people have looked at this for a long time, trying to work out why does this actually happen? Why do you get this incontinence? And, you know, some people used to believe that, you know, it was how the uterine stump adhered to the bladder, and it's going to affect the urethra and the pressure in the urethra, nerve damage from a rough surgeon, a complete lack of hormones, which is causing the urethra to leak, or does just removal of the uterus sort of change the whole position of the bladder, so you're more likely to get an intrapelvic bladder. And so there's been all sorts of theories over the years. People have looked at, does an ovariectomy reduce the risk compared to an ovariohysterectomy, and it's not made any difference, which sort of makes you think that, you know, surgical trauma and neuronal damage around the urethra is probably unlikely, because when you're doing an ovarectomy, you're not pulling on the uterus and pulling on the bladder and all the rest of it when you're trying to take the ovaries out, so it's a lot less traumatic. So people have looked at whether they're better to have an estrus period before they're desexed, but that didn't seem to affect incontinence. It does tend to be worse in larger animals compared to smaller animals. But it's more, I suppose, one of the biggest contributors is the time between desexing, you know, how long it's been since the animal was desexed. With time, the probability of incontinence developing is going to be higher. So animals that are desexed younger obviously will show the incontinence younger if they're going to get it, compared to an animal that's desexed at a much older age. So, but our current belief really is back to, as I said earlier, related to the changes with GnRH and LH, and in relation to desexing. It has recently been found that there's LH receptors in the bladder and the urethra, and interestingly, the desexed animals seem to have higher levels of LH receptors in the bladder and the urethra, and those with incontinence tend to have higher levels of these receptors. Obviously, the receptors result in reduced detrusor muscle sensitivity with the increased LH receptors, which is going to lead to incontinence. Traditionally, I suppose, we were taught at university years ago that it was all due to a lack of estrogen, but there's actually no estrogen receptors found in the bladder or the urethra. And that was related back to the fact that if you treated an animal with estrogen, the incontinence seemed to improve. And really that's providing a negative feedback on the hypothalamus to lower our GnRH and our LH levels, which is going to help to relieve a lot of those incontinent animals. And so this has been supported by the fact that if you have an incontinent bitch after desexing, then about 50% of them will actually respond to the use of a GnRH analog, so deslorelin or suprelorin. I've got to make sure we say it right. We all say suprelorin, but it's suprelorin. And animals improve, and that's certainly my first choice myself of for an incontinent bitch, that I would actually give a suprelorin injection. One, because it's just easy for the client; they don't have to worry about continued medicating of these animals every day or once a week with estrogen. There's no side effects to it, unlike estrogen. And then you've got phenylpropanolamine that you've got to keep giving twice a day, every day for the animal's life, which is laborious and expensive. So that's sort of how I suppose this has come about, that we've sort of found that that's the most probable cause for why we get incontinence in bitches post-desexing. And so if you had a male dog that was incontinent after desexing, then you know, that same process of deslorelin should improve them as well. My computer, there we go. So obesity, people have looked at, I suppose, it's again, we do find that animals put on a lot of weight after desexing. I personally find this is most profound if you have an older bitch that's desexed, or an older male that's desexed, and 5-6 years old plus. And I think there's just a change in metabolism related to their hormone levels that's sort of more dramatic than those young dogs that are desexed. They don't tend to get the as obese, but obviously it depends on breed as well. But one thing that's been found is that there's LH receptors in the brain, which is related to the satiety center, and so there's suggestions that due to the LH binding to these receptors in desexed dogs, the actual animals are actually hungrier, and so is it going to be this is going to be a contributor to obesity. So our treatment for these animals obviously is to stick them on RD or some sort of weight loss diet, but it's sort of, is it cruel in a way that these animals are actually starving and then we're cutting their food back because we don't want them to be overweight? And so, it's something that obviously, as you know, a lot of people will struggle with dealing with their animals that are obese and trying to get their weight down after desexing. So retained puppy coats, another thing to consider. After desexing, there's a change due to the lack of testosterone and estrogen. There's a change in the hair coat and the change in the type of ratio of the hairs that are there. And so you can see in like this, these pictures are from a paper that's been published on the use of deslorelin to basically reverse the puppy coat changes. And so we think it's all related probably to LH again. But that dog, the bottom 3 photos are where it's had this horrid coat. And then the top one is after it's actually been treated with suprelorin, which has improved. And it doesn't work in all cases, obviously, but those hair changes mean that the hair mats together more easily. It's harder to manage for people. Obviously, when you deal with breeders and you have all these very hairy breeds come in and you sort of talk to them about, it must be hard to keep it looking good, and they all talk about, no, it's easy because they've got a good top coat and a good undercoat. But when they're desexed, that undercoat essentially gets lost out and the fur mats together. And so, the pet owners sort of struggle to keep them looking as good, and you get people that question, why doesn't my dog look as good as what the breeders' dogs do? And that's a fairly marked effect of desexing. So mammary tumours, we know that that entire bitches have a higher risk of mammary tumours compared to desexed bitches. So mammary tumours are probably one of the more common cancers that we will deal with in dogs. The actual pathogenesis is not 100% understood, but we do know that there's estrogen and progesterone receptors found in the malignant tissue, and so these hormones certainly will contribute to the development of these tumours. A comment that we've found is that in humans they've shown a protective effect of breastfeeding against mammary breast cancer, I should say. And so I would actually say, and we've discussed this at a few conferences over the years, that it's probably similar in dogs. Like, we see a lot of entire animals that are bred and not a lot of mammary cancer. And I think some of the more aggressive mammary cancers that I've seen are in non-desexed bitches that were never bred. So it's something important to sort of put in the back of your mind. So there's a number of papers obviously looked at the risk of desexing and mammary tumours over the years, and these guys in 2012 did a summary of all the 13 articles at the time that were published, and it was interesting the results that they sort of found, that there was only one that showed desexing reduced the risks, 2 showed no association, most of them had high bias. And it's also important to remember that the paper we all quote and we were taught at university is a 1969 paper. And when they published this paper, they referred back to a 1968 paper for the incidence of mammary cancers in dogs. And these were the incidence rates that they found. And there's more recent papers which have looked at the incidence rates, which are getting similar levels to what they were back in the 1960s. So then in 1969 they published this paper, and the samples were all collected. They basically went to a pathology lab and said they want all the samples from all the mammary cancers that the lab had, and they went back and looked at whether the animals had been desexed or not, when they were desexed relative to their first estrus. Before their first estrus, did they have one estrus period or two or more? And then sort of looked at a risk analysis to see what were the chances of getting mammary tumours. But I think a lot of people get confused with this and sort of quote this as saying, well, after 2 estrus periods, there's a 26% chance that bitch is going to get mammary tumours. And it's not what the actual paper's saying when you read it. It's actually just saying that there's a 26% increased risk compared to the normal risk, essentially, of desexing before the first estrus period. So it's not to be sort of inherently scared that after 1 or 2 estrus periods the animal's got this massive chance of mammary cancer. And so it obviously is an increased risk, but it's not, I suppose, as detrimental as what we would sometimes have been led to believe. So prostate cancer has a low incidence. It's only sort of 0.1 to 0.7% incidence. They're almost always malignant. By the time you diagnose it, it's all too late. Poorly responsive to chemotherapy. They've usually metastasized by the time they're actually diagnosed. There's some papers sort of looking at the fact that, or suggesting that desexed dogs have a higher incidence of prostate cancer compared to entire dogs. I'm not convinced either way with this one myself. If you look at the papers, they sort of didn't separate the cases as what I probably would have thought they would have. And you know, a desexed dog was basically classed as any dog that had been desexed over 6 months of age and had been desexed for six months before the study. Before the diagnosis. So you could have an 8-year-old dog who was desexed at 7 years and 3 months and got prostate cancer at 8, and that would have gone into the desexed male group. You know, I don't think when you read the paper there's really any sort of great evidence to suggest that desexing increases the risk of prostate cancer. But yeah, I guess with time people might look at it a bit better. It's not what we'd normally think, that, you know, it looked at dogs that were desexed up to 6 months and then anything that was over 6 months, you know, 12 months, whatever, wherever you draw your line, didn't have prostate cancer. So just keep that in mind when you hear it's been spoken about. Obviously, there's other testicular tumours that have a higher risk. Obviously, if you leave the gonads in place, testicular tumours, ovarian tumours, they're not that common. Obviously, retained testicles have a higher incidence of testicular tumours. One of the good things about testicular tumours is they're most likely benign, and castration is going to be curative. There is a crossover time, I suppose, with retained testicles that, you know, as long as we remove the retained testicles by 3, there's no greater increased chance of cancer in those retained testicles compared to a dog that had 2 testicles descended into the scrotum. Ovarian tumours the same, they're rarely malignant. Uterine tumours are not that common as well. Again, ovarian hysterectomy in most cases is going to be curative. There's some papers looking at transitional cell carcinoma of the bladder showing an increased risk of that with desexing as well. So osteosarcoma, yes, there's papers showing increased risk of osteosarcoma in desexed dogs compared to entire males. Again, questions at the minute whether it is related back to LH levels. But yeah, there's some studies, there's some that are not great, I suppose, because they look at certain lines of dogs, and there's a fair genetic component to all of this. Like, it's not always just a straight, is it desexed or is it not? And genetics is something we need to think about, but certainly some of them, there's certain lines of dogs which most probably had just a high incidence of cancer to start with. So it's hard to make direct and I suppose proven benefits or problems. Same with hemangiosarcomas. You're still looking at cancers that when you look at these numbers, they're low incidence, but the desexed animals do have a higher risk compared to the entire animals in these papers. Obviously more so in the males in this one rather than the females. Another one, lymphosarcoma. Again, higher incidence in desexed animals compared to entire, and mast cell tumours is another one. Female dogs, there was just statistical significance if they're spayed for an increased risk of mast cell tumours, but there was also a trend there for males, but it wasn't statistically significant. So next thing we need to consider, I guess, is desexing and effects on behaviour. So I suppose a classic thing is that which I was always taught, that if you get an aggressive dog, the first thing you should do is desex it because it'll improve its behaviour. And it actually won't make the slightest bit of difference. I think it's a good thing to desex them because behaviour and temperament is inherited, and so it'll stop those animals getting bred with. But I wouldn't expect a change in the behaviour. So there is obviously with aggression in males that are entire, it's purely related to inter-male aggression over a bitch in estrus. But there's actually the opposite. There's a paper in I think it's in German Shepherds showing an increased amount of aggression in German Shepherd bitches which have been desexed. I don't know why. I don't believe, but it's just something to think about. I guess I have a personal belief with behaviour too that if you get an aggressive dog, probably the last thing I like them going through is a painful surgical procedure that they're in my clinic that they've then got to recover from. So I think that actually can make the behaviour worse with aggression. So I tend to use quite a bit of Cipralerin for male dogs that people may want to see what effect the desexing will have, or obviously they don't want to breed with them, but obviously it's a lot less traumatic on the animal to have an injection under the skin, and we can do the same bitches too if people want to see what they're like when they're desexed. But persistent juvenile behaviour, we know that if we do desex puppies young, then they can stay as puppies forever. We might like that, but I had a golden retriever client a number of years ago that at 11 years of age, this dog was still like a 6-month-old puppy, and I think 11 years of that would be quite hard to deal with. So prostate disease, obviously as males get older, the prostate enlarges. So the prostate is obviously the only accessory sex gland in the male, and it's the size of the prostate is going to be related to the fertility. So the prostate fluid is what is part of the ejaculate when the animals are tired, believed to have some effect to help carry the sperm to the oviduct. But the volume of prostate fluid that's produced is related to fertility. And so this prostate gland is designed to just enlarge and enlarge and enlarge as the animal gets older and older to promote fertility of your sort of older, more dominant animals. One of the problems is we get the animals to live longer than they probably should. So, we start seeing disease of the prostate because the animals that we have as our pets live longer than what the animals would if they were in the wild. So, but obviously castration, which removes the testosterone source, is going to allow regression of that enlarged prostate. We can use Cipralerin as well, but it tends to be a sort of, I would say probably a 5-year plus disease that we would see this, and probably the only real medical reason I could justify for performing a castration, full stop. Obviously, if you get rid of the benign prostatic hyperplasia, you're not going to get prostatitis, and you're going to reduce the chances of perineal hernias as well, because relaxin from the enlarged prostate will weaken the perineal muscles and increase the risk of perineal hernia. So this is sort of, I suppose, the medical justification, I suppose, for castration. So pyometra, obviously desexing stops a bitch getting pyometra and makes, a spay of a healthy bitch is a lot easier than an enlarged uterus like it's got in the picture there. Because obviously once we desex them, there's no hormonal influence on the uterus. But an issue too we've got to consider is stump pyometra with this whole business where we sometimes leave too much of the uterus behind. And pyometra is essentially a hormonal disease. It's not an infectious disease. It's not contagious. And obviously we remove the ovaries, so you technically shouldn't get disease of the uterus. But I think part of the problem is because we're tying off that stump of the uterus and cutting it, we're irritating the cells that are in there, and so we're going to cause a cystic endometrial hyperplasia reaction in that area, and development of inflammation and the stump pyometra. So, and this is where I suppose an ovariectomy is preferred, because you're not fiddling with the uterus at all, and the uterus is going to just regress with the lack of hormone production. Obviously, pyometra pregnancy is going to reduce, if you've got an entire animal, pregnancy is going to reduce the chances of pyometra, just purely by the fact that the only time that a bitch will lose the lining of the uterus is post-whelp. Otherwise, the endometrium just keeps getting thicker and more cystic as the animal ages. So infantile genitalia is something we've got to consider. Inverted vulva, it's important when we're vaccinating puppies to check for this. Obviously we can treat it surgically, but in most cases 1 to 2 estrus periods and the problem will resolve and the animal doesn't need to go through any surgery. Vaginitis is another thing. If you've got a puppy with persistent vaginitis, the best cure is to let them have an estrus period, and in general it will go away. It's pretty rare to continue to get it after that point. But if you desex an animal while they've got vaginitis, you'll be putting up with it probably forever. So if you look at inverted vulvas, you can see these animals that they're older, they would have been desexed with an inverted vulva. You can't even see it there. They're going to be predisposed to urinary tract infections, bad dermatitis as well, as a result of the urine pulling there. And obviously we can fix it with a vulvuloplasty, but it's a pretty major invasive, painful surgery that could have been prevented by just allowing these affected animals to have an estrus period first. I've only ever seen one dog myself that took 2 estrus periods for that to correct. The majority of them will correct after 1. So I guess we look at why does desexing affect these diseases? So as I said earlier, we believe it's all related most probably back to increased luteinizing hormone as a result of desexing. So LH is mitogenic and stimulates the production of nitrous oxide. So, anything that's mitogenic is obviously more likely to result in changes in cell sizes and numbers, and that's why is the belief behind why there's potentially increased risk of cancers in these desexed animals because of these persistently high LH levels. So obviously we know that there's LH receptors in the gonads, but there's more and more research getting done into this at the moment and finding LH receptors in pretty much every tissue in the body. And so really starting to think why this, what effect this desexing is having on all these other organs within the body system, that it's not just a matter of stopping the animal from breeding and could actually be increasing the risk of other diseases. So then we need to look at when and how to desex. We've got to discuss all this stuff with the clients, and I like my vets to have a discussion with the client about what's the best for their particular animal. And, you know, I get quite a number of people that want to come and talk to me about what the pros and cons of everything are, but we need to be able to talk about all these things so they make an informed decision as to when the best time is to do it, not just because we were told at university 6 months is the best, or the council says it has to be done by 12 weeks of age. Like, we've got to look at what is best for that particular animal. And just remember that desexing doesn't just affect whether the animal is able to breed or not. So then we'll look at what does the future hold, and then I suppose the more recent stuff that we're all hearing about is tubal ligation, ovary sparing spays, and vasectomies, and getting promoted quite heavily. I suppose it would start with tubal ligation. Tubal ligation, to perform properly, is a very, very difficult procedure. So the ovary of the bitch is contained within a bursa, and the uterine tube is tightly entwined within that ovarian bursa, and it's very, very difficult to isolate the uterine tube and actually ligate that. It is not impossible by any means, but it's quite difficult. And so this is sort of promoted as a way, I suppose, of essentially sterilizing the animal so it can't get pregnant, but leaving the ovaries in place, so we're getting all these benefits of their growth and development, and trying to prevent incontinence and reduce incidence of cancers as they get older. But you can see here, like, that's obviously a post-mortem picture, but you can see that's what we're normally faced with when we desex an animal, and you look at all that fat and tissue around the ovary. It's not an easy procedure if you want to actually isolate the uterine tube to ligate it. And we've got to remember there's important blood supply that runs between the ovary and the uterus, and we believe there's quite important communication which occurs between the ovary and the uterus as well. And so disrupting that blood supply doing this procedure may increase the risk of uterine disease, because we're sort of blocking this direct communication between, like if with scarring and trauma between the ovary and the uterus. And obviously it's a lot harder than in humans. And we need to remember there's no published technique. There's certainly YouTube videos that you can go and watch to do it, but to my knowledge, you won't find it in a textbook how to do this surgery. And so that leads to our next problem as to what ends up happening. And I've had a number of cases that have presented to me with animals that have had a tubal ligation, apparently, and then they have vaginal discharge or illness. And when we've opened them up to do surgery, this is what's seen for this tubal ligation. And this particular animal, you can see she's had a uterine ligation rather than a tubal ligation. And so you can see, one side of the uterus there has been almost cut out completely. They've obviously just put a number of sutures around different parts of the uterine horns, which has caused fluid to build up. So across here, there was a complete stricture. So there's fluid building up inside the uterus here because it has nowhere to escape. You can see that's all thickened endometrial tissue, cystic endometrial hyperplasia. So, this bitch particularly was a pyometra going somewhere to happen. And it's probably caused by the ligation of the uterus, irritation by the surgical procedure, but also possibly by disruption of that communication. You've still got ovaries in these cases, remember, and communication between the two. So that's not a tubal ligation, and that's not what you want to be doing if you're trying to do that particular procedure. So ovary sparing spay is probably a more common thing that's getting done nowadays. Again, no published technique. There's YouTube videos that you can watch of vets doing it from the States. And part of the problem, I suppose, with this surgery, I should say what it is first. So in general, the recommendation is you need to remove the whole uterus, and you remove the right ovary because it's more difficult to remove, and leave the left ovary in place. So if at some point that bitch needs to have surgery, the owner wants the ovary removed, it's easier to do for the next vet, hopefully. But there's no sort of standardized technique is a problem. So identification of these animals that have had this procedure done is quite difficult. The pet owners don't understand what's been done. They just think they've been desexed. And if you leave the slightest bit of uterine tissue there, so you really need to be removing the cervix if you're going to do this. So if you have the slightest bit of uterine tissue there, you're going to get a pyometra in that tissue because we've got these hormones still remaining because of the retained ovary. Another problem with this is, again, if it's done properly and you remove the whole uterus, those animals won't bleed when they're in estrus. So they're still going to cycle because they've got the ovary, but they're not going to bleed because the bleeding of a bitch's season is coming from the uterus. But they're still going to have the pheromones and the hormone changes. So males are still going to be attracted to these particular animals. Thankfully, I haven't had to deal with one, but a friend of mine in America has had 2 cases that she's dealt with bitches that have had this procedure done. They've actually been mated by a dog because they're still cycling. The owners didn't even know they were in estrus, and because obviously the vagina's sort of shortened because there's no uterus in front of it anymore, that cranial tie on the front of the vagina has ruptured during the mating, and they've ended up having sperm peritonitis and dying. So this is where communication becomes really important. So when people are buying, or if you're doing this procedure and your client's selling the puppies with this, it needs to be very clear that to the pet owners what they're actually purchasing and that it's had this procedure done. I guess my personal view is that it's potentially reducing the risk of some cancers, but we also know that it's increasing the risk of mammary tumours. And the argument to that is that these, animals should have regular mammary gland assessments. But I'm not sure how many clients would actually be able to do that. And then the other problem is, obviously, as you know, if you get severe mammary cancer, then it can not always a good prognosis for the dog. And also, if we get disease of uterine tissue remaining or a problem with the ovary, the animal will need another invasive surgery later, which is commonly happens. We get a few that come in that people have had this procedure done or purchase a puppy having had this procedure done, and then want them desexed properly because they're not happy with what they've got. So the other thing is, there's a group in the Netherlands which have shown that the bitches that had retained ovarian tissue have an increased risk of that tissue becoming or forming granulosa cell tumours, which are very rare. And so that's an important consideration, I suppose, we need to think about, that if you're going to do this surgery, again, are you actually increasing the risk of an ovarian tumour developing in these animals? So this is just some pictures of a bitch that I actually did surgery on last week that had had an ovary sparing spay done somewhere else. And again, you can see that's the left ovary on this side that was sitting there on its own. That's the right ovary. There was a bit of uterine tissue still attached to that, so it's all building up with fluid inside. The owner actually rang me because she was sick of the bitch bleeding every time she came into heat every 6 months. And I sort of discussed with her, if this procedure was done properly, she shouldn't be bleeding. She'd been told by the breeder to just spot a little bit of blood and that would be it at the most. But of course, it was a large breed dog, and so it bled a lot. And so she was sick of that. But then when we did the surgery, we can see that it sort of didn't show that well here, but the uterine horns again have been cut cranial to the bifurcation. So that's actually the bifurcation of the uterus here. And one of the horns had sort of twisted around and adhered itself to the bladder. And it was quite difficult to remove. When I looked at the ovaries, like this is a bitch that was in season, I think it was 4 months earlier. But she still had functional luteal tissue on these ovaries. And of course, 3 days later, I get the phone call that she's producing milk as a result of the surgery. But it's just, like I say, one of the problems, I suppose, that there's no published standardized technique for this, that it doesn't necessarily mean everyone's doing this how you should be doing it properly. And this was a puppy that was done before the owner hadn't purchased it, and she got no choice. That's just how she got the animal. And so, you know, these sort of procedures, I really think if you're going to be doing them, they should be done under consultation with the actual pet owner in question, not of a puppy before it goes. You know, and it's getting more common, this procedure in America, and my friends that do it, I'll go through why in a sec, but they'll have 1 hour consultations with these pet owners to sort of discuss everything I've just been through, risks associated with these procedures, and then to determine if the owner is actually still happy to go ahead with the procedure. And they all tell me that probably 90% of the people, once you go through it all, decide to just spay them properly, because, you know, worried about effects of this procedure and side effects and the headache of dealing with it all. Just my personal opinion, I think when it's done in puppies before sale, it's just merely you're helping to protect the income of the breeder, who doesn't want anyone to breed with their dogs. I think it's more important that these breeders are actually counselling their new pet owners on why their animal is not suitable to be bred with. Obviously, they keep the better ones to breed with themselves. And people don't understand, like the vets don't understand what's happened. The paperwork doesn't get through from the vet who did the procedure to the new pet owner. And everyone's confused and doesn't know what's going on. But if you had a client that was that concerned about all these side effects to desexing and essentially is going to be related most probably to increased LH levels, we would actually get the same effect by just desexing them properly and giving them suprelorin every 6 to 12 months. Suprelorin's going to block, it's a GnRH agonist, so it's going to lower LH levels, and it's going to have essentially the same, or is going to have the same effect as if that animal was still entire with negative feedback, feeding back onto the hypothalamus. And you've removed the ovaries, you remove the testicles in the boys, you're not going to get side effects to this drug of, you know, or this product, I should say, compared to leaving bits of gonads in place that are going to secrete hormones. So these procedures have really come about because in the US, suprelorin is illegal, or not available, I should say. I shouldn't say it's illegal. It is available for use in ferrets. It's got a specific label registration for the use of ferrets with adrenal disease, and it's actually got a specific, because it's the world's biggest ferret farmer in America, of course, and he's paid for this registration, I believe, himself, and it's got specific label registration that says it's actually against the law to use it off-label on any other species. So the vets over there can't use a product like suprelorin like we can, and so that's where these procedures have really come about, is trying to find alternatives for the people that are worried about the effects of desexing on their animals, that don't want them to breed but want them to, hoping to increase their longevity of their life. And so it's a different situation to what we have here in Australia. Like, we have this product, and I really myself can't see why we need to do these surgeries when we could be just spaying them and giving them suprelorin. Just finally carrying on from that, I'll just talk about ovarian remnant syndrome, which essentially an ovarian spay is deliberately causing ovarian remnant syndrome, which is something I reckon I get a phone call a week about this, with vets wondering what to do, how to deal with it. It's the most common post-spay complication that we've sort of fought and dealt with for years, and then we've got this new procedure come along that we are deliberately doing it. So I think people forget about that a little bit. But again, that's just the paper I spoke about earlier with the increased risk of granulosa cell tumours. So what other options do we have besides surgical desexing? So medical desexing. So, you know, Ovarid is still available. I use it every now and then, but we want to avoid products like Ovarid and Covenant injections because they're synthetic progesterones. They're going to increase the risk of diabetes. They cause CAH. They cause pyometra long term. Very out of vogue, obviously now. We can use long-term mobolerone or other anabolic steroids to stop bitches from cycling, but we've got to be careful again with side effects to these products. They can cause liver disease, they'll masculinize females, and you can end up with a female with an os clitoris that pokes out the vulva, increased tear production. Probably one of the best side effects to that everyone loves is increased hair growth. I've had yet to have someone complain about that one with the breeding world, but that's hard to get hold of. But we can use serpellerin to obviously medically sterilize animals. So in bitches, it's completely off-label. It's got a specific registration for use in male dogs in Australia. But if you do want, you can use it successfully to off-label to control the reproduction of females. And so how do we do that? We give it in early diestrus. So if you give serpellerin, because it's a GnRH agonist, if you give it when the animal is in anestrus, you'll cause a surge release of GnRH, which will bring them into season. And one of the problems is because it binds to the GnRH receptors, you get a surge release of LH and FSH, but straight away you're getting suppression and soon after, and LH is needed for ovulation to occur. So if you give it in anestrus, you're more probable to cause a follicular or luteal cyst formation, and in which case you're going to have to do surgical ovarian removal to fix that. So we give it under high progesterone because it won't induce estrus. So we need to ensure that they've ovulated. You don't want to leave it too long after they've moved into diestrus, just because if you give it too late in diestrus, it'll induce another estrus period and you'll end up with the increased risk of cysts. But if we then give it every 6 months, it'll prevent the bitches from cycling, and that's how I do it. I use the 6-month one every 6 months. I have tried the 12-month one, but I've found that if we give a 12-month serpellerin and then try and give another 12-month one a year later, it actually does induce estrus. So I don't feel it lasts long enough to suppress for long enough as what the 6-month one does by using it every 6 months. But you just need to be confident with where they are in their estrus cycle. So if you look at boys, so vasectomy is an easy to perform procedure. It's basically make the same sort of incision that you would as for a castration, and if you feel either side, you'll feel the spermatic cord. You dissect out the ductus deferens and cut a section of it out rather than just tying a ligature around it in case it doesn't work. Sorry, I've got something in my throat. You just got to be careful to not obviously damage the pampiniform plexus and cause damage to the epididymis and the testicle itself. So we just ligate a small section of the ductus deferens and just a routine closure. But medical desexing, sterilisation again in the males, in Australia, the only product we have available is serpellerin. There are products that you can inject into the testicles overseas, which will cause necrosis of the testicles and sterilise them, but we don't have them here. So serpellerin's the go-to if people don't want to do a surgical castration. So you just got to remember when we're using this product, if you're using it in a breeding animal, that the effect of it can be quite protracted. So there are some animals in the studies that were actually sterile for 2.5 years following a 6-month serpellerin, and it also doesn't work straight away. So it'll take 4 to 6 weeks, up to 4 to 6 weeks, to actually work and lower the testosterone levels, and then you're still going to have sperm in that coming out in the tract for another sort of 2 to 4 weeks after that. But again, it blocks, wrong way, GnRH receptors and keeps our LH levels low. So just in summary, as I was saying, we just need, I don't think there's one recipe that suits all animals for desexing. We need to consider the needs of the client, the needs of the animal, discuss the risk of cancers, diseases of the reproductive tract, male or female, and if someone is looking to do one of these alternative surgeries, discuss pros and cons of it, so they're fully aware of what's going to happen to their animals. And I guess we've got to remember, as I've said there, that a lot of this with LH is still in the research phase. It's still a bit of a theoretical thing. It's most probably correct, but it's not 100% proven. And so I suppose just to throw a spanner in the works, you've got to remember that most entire animals that we're looking at with all this stuff, which most of the research, a lot of it's the US at the minute, are going to be our genetically superior animals that have been left for breeding. And so you could argue that is it partly happening because these genetically superior animals are being left entire, that they actually have a lower chance of cancer? So I don't know, just got to think about it. And then just finally, I'll just go through what do I recommend. And I'd always let a bitch have a season before I desex, no matter what size she is. I desex her 3 months after her first estrus, because by then the corpora lutea of diestrus should have disappeared. As I alluded to earlier, if you desex an animal in early diestrus with an active corpus luteum, you're going to get a sudden drop in progesterone, which is going to cause a rise in prolactin and induce lactation. So it's just easier on the owner if you do it at that stage. We always check that vulval conformation is correct before we desex them. I don't believe the increased risk of mammary cancer after one estrus is significant to be saying that you definitely have to do it before that first estrus period. But, you know, as I said, you've got to discuss it with the client. There's some clients that'll still be horrified with their bitch bleeding inside the house. So, you know, they may still be candidates for getting desexed before their first estrus. If people are worried about, as I said, you know, the negative effects of desexing potentially related to LH, then I'd be recommending to give them serpellerin annually, using obviously the 12-month serpellerin. I prefer to do ovarectomies rather than ovariohysterectomies. They're quicker, they're easier. You can make a smaller incision. You can make it a bit more cranial. You get good visualization of the ovaries, and less morbidity associated with it. But obviously, ovariohysterectomy, if we're going to have older or diseased uterus. Males, I would say, desex sometime after 18 months of age so that they're fully mature. And I'd do the same with cryptorchids. We'd usually castrate a cryptorchid dog at sort of 18 months plus, 18 months to 2 years, something like that. And the same with annual serpellerin post-desexing if needed. And then when we look at puppies, when people want to desex puppies, I really personally believe that you either just do it properly or don't bother doing it. And so we would only ever do ovarectomies or castration, or we just do nothing. And I think that is it. Thank you.
Thank you. That was a really informative lecture, and we've got quite a few questions actually, if you have time.
Yeah, sure.
Perfect. Okay, so Ian asks, when you discussed unwanted distribution of germ cells during castration, does incising the testicle and, you know, leading to this apply to cats as well as dogs?
Yes, exactly the same. So if you leave any sort of germ cells or Sertoli cells behind on your incision, then yeah, there's a risk of a cancer developing. So yes, any male animal that would happen with.
Mm-hmm. Thank you. There's another question about UMSI. What intervals are you requiring the use of GnRH analogues in these cases? Is it 6 monthly as well, or do you have to give it at a specific time?
Yeah, I usually start with the 6 month serpellerin first, mainly because it's cheaper than the 12-month, and see if the animal actually does respond to it, because obviously if they don't respond, I'll usually then be putting them on phenylpropanolamine. So I'll give them the 6 month one, and then after that, if we get a favourable effect, we'll just give the 12-month one annually. But yes, I know that the serpellerin can last for more than 6 months, but we tend to just book them in like an annual checkup, that every 12 months from that point, at the end of the 6-month one, we just keep giving it routinely rather than waiting to get incontinence back. Yeah.
Right. Okay. Great. Jose asks, when you said empty estrus, do you mean there is no pregnancy? And if this is so, is it okay to presume that pregnancy also has a protective property to mammary carcinomas?
Yes, that's what I was alluding to. So repetitive empty cycles is a bit like it increases the risk of mammary tumours. We would think it's going to increase the risk of, increased risk of pyometry is going to increase the risk of mammary tumours as well.
Amelia asks that she has her own 15-month-old Labrador, and she's having a bit of trouble deciding whether to spay and if so, when to spay her own dog. And she's a vet with all the information. So she points out how a client's supposed to decide what's best.
Well, yeah, I guess with your own dog, if you're not planning on breeding, it was a female, wasn't it, you said?
Yes.
Yeah. So if it was a female, I would wait until after their first estrus. So if that's 10 months, I'd do it 3 months later. If it's 18 months before their first estrus, I'd still wait 3 months after that. But I think there are a lot of beneficial effects to the hormones, especially on their growth and development, that I would wait until after that. But there's no benefit, I don't believe, unless they have a continually inverted vulva, to having 2 estrus periods.
Points. Michael asks, why would you perform ovarian sparing surgery with the mammary cancer risks? Why would you do this at all?
Well, I guess this is the whole thing. So people are balancing the risk of other cancers against the mammary cancers, and the argument is that you can manually feel for mammary cancer, whereas if the dog has hemangiosarcoma, unless you're going to ultrasound it all the time, you're never going to know until it actually presents itself. But yeah, as I said, I would agree in Australia, when we can use deslorelin to potentially stop the other cancers, I don't believe there's any need to do that procedure myself.
With regards to the procedure you recommended, the ovarectomy over the usual spay, what resources would you recommend to vets that want to start employing this form of surgery?
As in,
is there any tips?
Technique?
Yeah, technique.
I'm pretty sure it's described in the major surgical textbooks, but it's basically the same as a spay. Like, you do the ovarian pedicle the same as a spay, and I'll just put a hemostat across between the ovary and the uterus. There's like the little ligamentous area there, which obviously is going to have the oviduct in it, and just clamp that and try and keep as much away from the uterine tissue itself, and just put a ligature around that side. But I'm pretty sure it's in all the textbooks.
Thank you. From Mick, by what age should a male dog be castrated to reduce the risk of developing a perineal hernia?
So it's related to benign prostatic hyperplasia. So lowest risk, 5 years of age.
Great. Thank you. I think that's most of the questions there. I think you've covered a lot of them. There's just a couple that have just come through quickly now. Paul asks, do you recommend to desex females 3 months after the first estrus? Does this apply to both dogs and cats?
Yeah, I haven't really spoken about cats, have I? Cats,
that personally offends me as a cat vet.
Are you a cat vet?
Okay.
Sorry. I thought it was meant to be just about dogs. I was sort of dodging the cat bit. So cats, a cat in estrus is a pain in the rear end. And I actually don't have a problem with juvenile desexing of cats. It's not such a big deal like it is in dogs. And most cat breeders obviously do desex them as kittens. So cats, I like to let them grow a little bit still, but I would do it before their first estrus. They don't get incontinence.
Yeah, I have a 2 kilo rule. I'm scared below then.
Yeah, fair enough. Yeah.
Ben asks about a recent article which recommends not desexing female golden retrievers due to an increased risk of elbow dysplasia. Is this a valid recommendation in your opinion?
I've never found anything related to elbow dysplasia and desexing. probably the only thing it may be related to is the growth plate closure, I guess. But yeah, I haven't found any particular paper in general that says you've got an increased risk with desexing.
Thank you.
Whereof.
Susie asks if you could please repeat what the advantage is of spaying 3 months after the first estrus.
Okay, so it's related to the cycle of the bitch. So if you remember, bitches have an obligatory diestrus period, so they're not like other species that have maternal recognition of pregnancy, and so if they don't have a pregnancy, the corpus luteum just fails after a few weeks and the animal cycles again. So bitches, spontaneous ovulators, functional corpus luteum will form after they ovulate, and that corpus luteum will remain active for most commonly up to about 12 weeks, and continue to secrete progesterone. And so, you know, if you look at a pregnant bitch, I suppose it makes it easier to explain. When a pregnant bitch whelps, it's caused by the sudden drop in progesterone. But that sudden drop in progesterone stimulates a rise in prolactin, which stimulates milk production. And so if you have a non-pregnant bitch with an active corpus luteum there, you remove that, you're going to suddenly drop her progesterone level. She's going to get a rise in prolactin, and you can obviously treat that if they start to produce milk. We can treat them with cabergoline at 5 micrograms per kilogram for usually 8 days, and that will dry the milk up. But it's just a bit more of a headache for people to have to deal with.
Yes, I haven't had to do that for a while, but
No.
yeah. Helen asks, why do you recommend later desexing for small breed male dogs as well as large breed ones? I guess what's the benefit for smaller male dogs, smaller breed?
Yeah, I guess as I alluded to earlier, I don't know if there's a great medical reason aside from prostate disease or retained testicles to actually castrate a male dog at all. So I still think they're better to have the hormones present and active for longer to get their still correct growth and development occurring.
Great. I think that's answered most of them. There's a lot of questions coming through now and a lot of thank yous.
No
looks like the lecture was very well received, and I enjoyed it thoroughly as well. So thank you very much for your time tonight.
No worries. Thank you very much for having me.
And thank you to Verbac for sponsoring such a really useful and informative lecture as well.